When priming the MaxPlus Clear, always invert the device and prime up. Gently tap the connector while priming to purge all air. To attach the MaxPlus Clear, remove the protective cap at the end. Attach the male lure to the female hub of the vascular access device and rotate it until it first stops. At this point, there is no need to tighten any further. Do not over-tighten. For access and removal, always grasp the MaxPlus Clear connector to reduce over-tightening or unwanted loosening from the vascular access device. Remember to swab prior to every access with an appropriate antiseptic and allow to dry. Experts suggest that friction and time enhance disinfection. To administer through the device, insert the lure from the primed IV set or syringe by positioning the male lure into the MaxPlus Clear using a straight motion. If the mating lure is a two-piece spin collar, pull back the collar, insert the lure using a straight motion until well seated, then bring the spin collar down and tighten. Don't over-tighten the spin collar. Lure slip syringes may be used when attended. Insert the lure slip with a straight motion and give a 1/4 turn clockwise to seat the lure. Never leave lure slips unattended. Flush the connector and catheter using your facility's recommended technique. Some facilities include a push-pause technique in their protocol as an effective method of clearing the catheter line. To aspirate blood through the MaxPlus Clear device, be sure to follow your facility protocol for blood draw. Swab the top of the MaxPlus Clear with an appropriate antiseptic. Access the connector with a syringe to check for patency and aspirate discard if required. Dispose discard according to facility protocol. After aspiration of discard, swab the needleless access device again. Access the connector with a lure lock blood collection holder or syringe. Collect the desired blood sample. Remove the blood collection holder and swab top clean. After a blood draw, the MaxPlus Clear device needs to be flushed clear with normal saline. Research suggests a push-pause technique is an effective method of flushing the catheter. Remember, the clear housing lets you see inside the connector, so you can make a determination if more or less flushing is needed to effectively clear the connector and the line. A clear connector equals a clear line. To disconnect from the MaxPlus Clear, hold the device and rotate the mating lure counterclockwise until disconnected. Upon removal, a positive bolus of fluid will clear the catheter tip and lock the catheter to prevent reflux and maintain patency. This is the feature that allows the device to be flushed and locked with saline rather than heparin. Upon disconnect, you may notice a small droplet of fluid on the access port. This is normal. Simply swab clean with a prep pad and discard accordingly. Remember to always disconnect first, then clamp to confirm that the positive displacement feature of the MaxPlus Clear is utilized. Remember, always prime up. After swabbing, allow the alcohol to dry for maximum disinfection and to prevent alcohol bonding. Always grasp the MaxPlus Clear body when connecting or disconnecting to prevent over-tightening or loosening. And always disconnect first, then clamp.